Tonight, the FDA says there could be a possible link between rare neurological complications and the Johnson & Johnson coronavirus vaccine. John Lorience explains the investigation now underway to keep safety a top priority.
The CDC and FDA have launched an investigation into a potential link between the Johnson & Johnson COVID-19 vaccine and rare cases of a neurological complication known as Guillain-Barré syndrome that can lead to muscle weakness and possible paralysis.
So for them to announce this investigation, it means that they think that there's a plausible link. It shows once again how carefully we take the safety of vaccines in this country.
The FDA has updated the label for the vaccine to say there may be an increased risk of Guillain-Barré syndrome in people who recently got the Johnson & Johnson shot. But the CDC stresses even if the vaccine does raise the risk of the syndrome, it's still better to get vaccinated against COVID-19. Vaccine maker Johnson & Johnson confirms it is reporting any information on adverse effects linked to its COVID-19 vaccine to health authorities, saying in a statement, "We strongly support raising awareness of the signs and symptoms of rare events to ensure they can be quickly identified and effectively treated. The chance of having this occur is very low, and the rate of reported cases exceeds the background rate by a small degree."
Even if it ends up being real, it's still fewer than 1 in a million vaccine doses that end up with this syndrome. And there are around 3,000 to 5,000 people that get Guillain-Barré syndrome every year with or without vaccines.
John Lawrence, KMBC 9 News.
There are concerns as the Delta variant continues to spread in both Kansas and Missouri tonight. Latest numbers show Kansas's positivity rate has doubled since Friday, now at 7.1%. It hovered around 3% just last month. Now in Missouri, it's up to 12.3%. That's the highest that it's been since January. And this comes as hospitals continue to see more COVID-19 patients. Down in Springfield, the Cox Health System has 125 patients. The hospital CEO fears that next week the number could be as high as 178. He says that number is well beyond their capacity. Hospitals in Kansas City have taken in patients from those hard-hit areas. Steve Hager works at Truman Medical Center University Health, and in addition to the typical workload, he says the network of hospitals is also seeing patients who delayed care for months. He says another surge could be prevented through vaccination.
We see staffing shortages. Our staff are just worn out, and it's all of our hospitals, it's all of our healthcare providers. They've just really had a tough year, and anything we can do to help that is going to be appreciated.
And we also checked with HCA Midwest Health, and a spokesperson says that they have staffing contingency plans just in case there's a major surge. He also adds that they have the opportunity to add beds if needed. On the other side of the state line, doctors in Johnson County say COVID cases are going in the wrong direction. The county reported 94 cases of the Delta variant today. The county's health director says most of those cases were people who have not been vaccinated. He says many of the cases are in people younger than 50. The virus is spreading from outbreaks at church camps to the workplace, even just busy summer activities.
We stand really a high risk of losing some of the gains that we have made because we are not taking the right steps. We are not getting vaccinated. We are not wearing masks when we are not vaccinated.
Almost half of the people in Johnson County, Kansas are fully vaccinated. Health leaders in Douglas County are concerned as well. The county has a high vaccination rate, but as KMBC 9's Matt Fleener explains, the Delta variant is still causing trouble.
Cases of COVID-19 are still relatively low compared to this past winter, but they have seen a rise in cases here in Douglas County, and that's causing concern for one business owner.
Hi, welcome. We were probably one of the most cautious businesses on Mass Street.
At Wonder Fair along Mass Street, face masks are still required.
Huge fan of the vaccine, love it.
Co-owner Paul DeGeorge says vaccines save lives too, trying to run a business as safely as possible, knowing cases of COVID and the Delta variant are on the rise.
We have a kind of a small store as well, and it can get pretty crowded. So, and also knowing that children are still unvaccinated.
DeGeorge heard the news Monday that 62% of new COVID cases in Douglas County are people eligible for a vaccine but have yet to get one. That means a third of cases could be young children, people who've had just one shot, or breakthrough infections where vaccinated people get the virus. But
none of the cases of breakthrough infection have the serious complications associated with it, so they are considered to be the more mild cases, so they're not causing hospitalization.
workers with the health department are still trying to vaccinate as many as possible,
What we are doing right now is a lot of community clinics.
encouraging everyone in the community to stay safe.
Right now, we don't have to worry about like what our next move as a business is because we're still requiring it, and that feels comfortable for us anyway.
Cases of COVID-19 are still relatively low compared to this past winter, but they have seen a rise in cases here in Douglas County, and that's causing concern for one business owner.
Right now, the average new daily case count in Douglas County is 4, but that's compared to just 1 a day just a couple weeks ago. Wyandotte County, Kansas is giving away $1,000 each day to encourage more people to get vaccinated. Starting Wednesday, each person who gets a shot also has 2 chances to win a $500 Visa gift card. The county says interest in the vaccine was steadily declining until they started this incentive program.
And incentives that will push them over the edge to get vaccinated.
Any Wyandotte County resident 12 and older can enter to win. Vaccines are given out Wednesday through Friday at the Health Department building at 78th and State Avenue.